So now that we've talked about symptoms a bit, we're going to talk about some things that can trigger anxiety for us. Being mindful of the community that we are speaking with, we picked four categories to put triggers in. Now, triggers can be somewhat common for people, and they can also be very unique and very individual. So we ask for um, some leeway in sharing what some of these are with you. They could identify for you, or they may not at all, and that's completely fine because we are each individual people and we have our own stories as well. And our hope is that by walking through some of the tips around this information, it would help you figure out better how anxiety impacts you, what the triggers are for you, and as we move forward, what strategies work for you. Sometimes that can be common to other people, and sometimes it can be very different and unique. So the four categories that we are going to focus on for where triggers can occur are going to be family relationships, friends and peers, um, illness and health, and worries. And so the first two I'm going to cover here for us. And again, just to clarify, triggers are things, people, situations, anything that can bring about or cause a start of those anxious feelings for us. If we can figure out what our triggers are, sometimes we can actually avoid some of the anxiety that's going to follow. Sometimes we might not be able to avoid the anxiety, but we might be able to avoid the intensity of the anxiety and the amount of time it lasts for us. So it is really important for us to slowly work through how to identify what are triggers that bring about those times or episodes of anxiety that seem to last a really long time for us. Again, for the age brackets that we're discussing, we've picked these four groups, but while these things are kind of targeted towards the age bracket, they are relevant to all of us, and at the same time as being relevant to all of us, they may not fit into what is a trigger for you, and that's okay. So under family relationships, things that can trigger anxiety for a person could be uncomfortable or awkward relationships. Sometimes an example of that can be for a child who has that distant aunt who always comes over and wants to grab their cheek or give them a kiss or make them give them a hug. And maybe they're really uncomfortable with that because that person feels like a stranger for them. That could cause anxiety. So that's just an example. Abuse, aggression, or violence, that could also just be verbal, that could be nonverbal. Neglect or not being paid attention to enough. Too many responsibilities. Having to move locations a lot. Not having fun or bonding time with others in your family. Not having personal space. Example of not having personal space could be something for a teenager that they don't really have a designated space where they could go and do their homework or maybe talk to their friend without everybody else in the family always being around and having that noise barrier. That could be something that creates a bit of anxiety. Past traumas, incidents, injuries, deaths that may have occurred in the family, those can be things that cause anxiety or bring on anxiety. So that could be if grandma or grandpa passed away and died, talking about them could bring about anxiety in a child or a teen that had a really strong relationship with them and hasn't fully processed the grief space for that. Having conversations around that, instead of it being fun for having the memory stay alive, it can cause anxiety. Not meeting expectations in family. So if there's a list of responsibilities or chores that everybody kind of does and just not being able to meet up with that all the time and then being worried about not meeting up with that and what everybody else in the family might say, that can cause stress or anxiety. And then wishing to be different. If someone feels like they don't really fit in their family, that can cause anxiety. So these are just some examples of dynamics in family relationships or things that can pop up situationally in families that could be triggers for anxiety. Moving to the next category of friends and peers and social situations. There's a lot of things in this category because it moves outside the home of where it could feel like it's more safe and there's more safety and security in a home, and then moving outside where you now have to interact with other people or see other people or other people see you. Sometimes that can cause anxiety if there's too many people around. Not having any friends or not being sure if your friends really like you or if they don't always include you. Sometimes if a child or a youth has been left out or forgot at one event by friends, or they weren't called just for one time, that can create a rise in anxiety for them moving forward, wondering if their friends actually want them to be a part of the friend group. And it was only one time, but we know the example of how a child could have had many pet dogs and pet dogs all the time, and they love dogs, all kinds of positive interactions, and then one time they get bit by a dog. And moving forward, the only thing they remember is the one time they got bit, not the 100 to 500 positive interactions that they had. So a trigger, a situation that causes anxiety, can be very significant for that situation and for the future of moving forward in that situation, which is why recognizing triggers is really important. So continuing with some triggers in friends and peer social situations, not knowing about a lot of the things that your friends talk about could sometimes cause anxiety. We all come from different types of families and different types of backgrounds. We can be exposed to different things that are out there on social media or in the news, and having a friend group that talks about things that you don't really know about could cause anxiety. Being pressured to answer or participate or make decisions or be put on the spot, whether that's with a friend group, it is in a classroom situation or a sports situation or a group counseling or a group or extracurricular group, being put on the spot can cause a lot of anxiety. Being pushed to pick sides in friend groups and even in families, but in friend groups, that can cause a lot of anxiety for children and youth and for adults. Being forced to have to act or make a decision in a way that feels uncomfortable and you're not prepared, that can cause a lot of anxiety. These things kind of lead to that obviously bullying and peer pressure cause an incredible amount of anxiety on our children and youth in society today. And I think, to be honest, many of us underestimate just how much that is going on and to the degree that it does impact all of our kids. We have classroom sizes that have large numbers of kids all coming from different backgrounds, and there is always some degree of peer pressure and bullying that goes on. It doesn't always have to be overtly right in your face, it makes sense, but it can be something that's more passive, and that can affect kids and our children and youth over time. And then simple things like not getting enough sleep or the proper nutrition, not having a regular patterned schedule for eating and sleeping, that can cause anxiety. Not that it makes you think, oh, I'm anxious, I didn't have lunch at 12 o'clock today. But the fact that your body didn't get the patterned lunchtime that maybe it's used to could cause internal body feelings that bring about anxiety. Remember, anxiety is not always identifiable to an external trigger or an external reason. Sometimes we don't know why it comes on. Not having a creative or active hobby during the day or during the week to have a brain break, and whether that's from school responsibilities, it's from family, or it's from doctor's appointments, or it's from extra support appointments, whatever that is, not having a break away from the thing that takes up a lot of time and energy and emotional energy, not having something different can bring about anxiety, because your body, your brain, your heart, your soul, it needs a break to kind of refresh, rest, and get a recharge. And that happens by having that break of something different. And generally, that involves some type of physical movement or some type of creativity. And the last thing we have here under our peer social group that can be a trigger is not feeling accepted or having a supportive friend group that can understand who you are and what you might be going through and be okay with that. So coming from the rare community for kids and youth that have friends that are not aware of rare disease and the impacts it can have on your family, that can be difficult to have your friends understand maybe why you're late or why you're tired or different reasons like that. So it is important to feel accepted and connected to a friend group. And if we're not, that can cause anxiety.
Thanks, Courtney. So as Courtney mentioned, two other groups that we're going to discuss today. And one of those is illness and health issues, specifically because we're working with you, the rare disease community. And then the second group is thoughts, worries, things from the past, the present, and the future. And we know that challenges come up in tons of different types of relationships and thought patterns, and they manifest themselves differently. There can be issues with family, with friends, with schoolmates. There can be issues with the adults in your life, if they're teachers or there's coaches or doctors. And then on the thoughts piece, lots of thoughts about the past, dwelling on the past if there's been tough times. Right now, you might be going through a stressful event or worrying about the future. And so as we look at some of these are just a very small sample of some examples, but the ones that we thought would be relevant. Under illness and health issues, not feeling well enough to participate in learning in sports. You want to, but you can't because your body's not feeling up to the task. Maybe you have somebody that's ill in your family. Maybe someone in your family has passed away. Sometimes it hurts too much to do normal life. So coming from the rare disease community, we know that sometimes there's a lot of chronic pain, and that pain can be here limiting your abilities, but your brain's over there wanting to do a lot of those things. And that can be a trigger for us. We know that the medical appointments, time after time, seeing doctors, it can be tiring, it can be hard on you. And that in and of itself, just going into the doctor's office can be a trigger as well. When it comes to thoughts, so many thoughts come to mind when people are dealing with health and wellness. What if I never get well? What if they never figure out what is wrong with me? The rare community specifically deals with that unknown piece of the diagnosis journey and that lived experience. And even if it's not you that's going through that experience, when you're close with your family members, the worry doesn't really get any less when you're not worrying about yourself. And that can be an ongoing trigger. Thoughts around the future. Every young adult has ambitions to do something with their life, whether it's working in retail, maybe it's going to college, thinking about that, but then worrying about that. And what am I going to be able to do? What if my friends get tired of me always being sick? I wish I could do more stuff. Will it always be this way? Wishing that it was different. And just that thought in and of itself, wishing things could be different and getting stuck in that space, that can be a trigger. And so we know that everyone has triggers. Some of them are common and some of them are very specific and unique to us based on our own situations. Learning what our triggers are is important as it helps us to prepare how to handle our anxiety when the next trigger might occur.